This is Dr. Daniel Paul, orthopedic surgeon with Easy Orthopedics, and today we're going to talk about, does a herniated lumbar disc always need surgery? If you like this video, we put out new content weekly, so please like and subscribe. So, does a herniated lumbar disc always need surgery? The answer is no, it doesn't. So, if you get an MRI of someone's spine, you're always going to find some small disc herniations, right? And the older someone gets, the more you'll find. The only people who have a normal spine on MRI of their lumbar spine are people like who are teenagers or early 20s. Once you get older, you essentially always have like stuff there, whether it's arthritis, whether it's a disc or anything like that. So the question is, when does it need surgery and when does not? So what is back surgery good for? It's good for relieving nerve pain, basically pain traveling down your legs. So if you have a large disc and that disc is pressing on a nerve and it's not going away with conservative treatment like physical therapy, massage, chiropractic care, or injections, then that's when it needs surgery. And the surgery is not for back pain, it's for leg pain. So if you have a big herniated cervical disc, nothing's working, you have terrible leg pain, like that's when it needs surgery. Some surgeons will operate on just plain old back pain. That's usually the people who get surgery and then they tell you that they're not any better and they're actually worse afterwards, so I would not recommend it. But for pain going down the leg, yes. So to sum up, does a herniated lumbar disc always need surgery? If it's pushing on a nerve and the pain isn't going away, then yes. If it's not, then no. And there is one more thing, that if it's pushing on the central area, like all the nerve roots, it can cause something called cauda equina, where it causes like loss of bowel and bladder and numbness on the inside of the leg. That's a surgical urgency that needs to be taken care of in the first 48 hours. But most people don't have that. They just have generalized back pain, sometimes the pain traveling down their legs. So I hope I was able to answer your question about when does a herniated lumbar disc generally need surgery. If you have any questions I didn't answer, feel free to leave them in the comments below and I'll do my best to respond. But I can't give you any specific medical advice because this video and all my videos are for educational purposes only. Thanks for watching.